All right. So why don't you take turns and tell me what you feel your comfort level is with searching PubMed and areas where you feel that you need extra help.
So for me, I actually started to do some searching last week on a literature topic with my librarian here. She kind of walked me through it, and I had forgotten how to do it because the last time I did it was as a resident. So she actually was the same person who trained me to do it as a resident.
Was that Lisa?
Yeah, Lisa Kilburn.
Yep.
Do you know Lisa?
Yeah, I work with the AHEC librarians around the state.
Oh,
So,
yeah.
yes.
So she helped me to start some searches and told me to use, I think it's called Corvidence or something like that. I can't remember the name of it.
Covidence to do screening? Okay.
Say it one more time.
Covidence?
Yes, she told me to use Covidence to help me to narrow down for my system, for the systematic review.
Okay.
And kind of alleviate some of the topics that I had in that way.
Okay.
Yeah. So how comfortable am I? Not comfortable at all.
Okay.
Just because I haven't done it much.
Okay.
Yeah.
Kerwin? Oh, go ahead, Joel.
I was going to say that from my side, my librarians have kind of spoiled us, and they basically, you can just ask a question and they will do the literature search for you, provide any articles that you want. So I really haven't done my own literature search since intern year. So that's about 5 years ago now, just because they can do pretty quick turnaround and can kind of get very good high yield data pretty fast. So I have not done any of my own in a long time.
Right.
Okay. Kerwin, what about you?
I'm not very comfortable, so definitely looking for what you have to offer.
Okay. Let me go ahead and share my screen so we can look at slides. And then if you have the ability to follow along and do your own searches as we're working through that, that would also be maybe helpful for you. So you should be able to see my slides in front of you with, okay. So again, here's my contact information, and I am the head of clinical and statewide engagement, and I'm also the School of Medicine librarian at HSL at UNC Chapel Hill. So our agenda for today is as follows. So we're kind of gonna do that formal training. Whoops, we've got 2 more people. Got a couple more people joining us. Okay. So I think we have 7 now. Hello to our new attendees and welcome. We just are getting started with today's agenda. So we're going to go through kind of that formal PubMed searching where we're going to go through PICO and what that means, creating search strategies and also using mesh terms to increase the number of results, and then using field tags and filters to also increase or decrease your search results. And if we have time, we're going to look at my NCBI, which is, all right, what are my slides doing? Which is a way to allow you to save search strategies, to receive weekly or monthly emails on a specific topic, and also sending results to other people. And if we don't get to that today, it will be in the slides and you can refer to that if that would be of interest to you. So for the 3 new people who have joined, does anybody want to introduce themselves and what they would like to get out of the session today? David?
Hello, it's David. I'm up in Boone, North Carolina, where it's raining a bunch. And I'm with the new residency at Mayhec and, or with Mayhec. And yeah, I guess I just looked to be more efficient and I guess thorough.
Okay.
with my searches.
With your search strategies. Lisa, what about you?
My Lisa, hi. Sorry, I was just in patient care till like 1 moment ago, and so
You're fine.
I'm garbage at finding literature. I'd like to be less garbage. That is what I'd like. Thank
Okay,
you.
well, hopefully by 1 o'clock today, you can say that you've moved out of the garbage into a smaller waste can, or even into that expert searching category where you feel comfortable. And we have one other person who's joined. Okay, we'll go ahead and get started. Everyone should be able to see my slides. And all right, so we went through the agenda for today. So the first thing I always like to teach as you're looking at searching is formulating a clinical question to help you gather evidence. And that does a couple things. It helps you realize what areas you need your search to focus on. And it also allows you to know what you need to search for at first and what you don't. So the PICO is one of the ways that we teach this for medical students, nursing students, and it's kind of a basic framework in terms of setting up your search strategy. So the PICO is as follows, and I preface this by saying not all of your searches will end up fitting neatly and nicely into the PICO format. And I also say that if you have 2 subjects and you know what you're looking for, you don't need to go through this process, but it's just a way of helping you frame your clinical question. So the first thing you're looking for is your patient population. Then if you have an intervention or an issue that you're looking at for that patient population, if there's a comparison, if you're looking at one drug's efficacy versus another drug's efficacy, you're going to need both of those drugs in your search strategy. And then finally, if there's an outcome of interest. And this sometimes is good to add to your search, and sometimes it can weigh it down and give you 0 results if you're looking specifically for an outcome. So sometimes you want to just leave that off at first. So to go into additional details about PICO. So patient population problem, how would I describe a familiar group of patients? What is the intervention and exposure or prognostic factor? Again, if there is a comparison or an alternative, what do I hope to accomplish, measure, or improve? Then you can add a few other things which makes PICO PICOT or PICOTs, and that would be what type of question am I looking for? What type of study? Am I only looking for randomized controlled trials? Am I only looking for systematic reviews? And then in what time period? In the past 10 years, I am looking for, you know, ... whatever that search strategy is. And then finally, if it's pertinent to your search topic, where is this patient being seen? Are you looking at a patient in only the outpatient setting or only in the ER? That would need to be, those frameworks would need to be added to your search strategy so that it's specific to that setting that you're looking for. And again, if I didn't say it before, if anybody has any questions as we're going through this, feel free just to speak out at any time, just say your name, and then I'm happy to entertain your questions at any time as we're going through this. Obviously, if we would be in a room in ACOC in the Family Medicine building at UNC, it would be more of a discussion and hands-on and group work, but this is you know, what we're dealing with in today's environment, and I want to make this as interactive for you all as I can. So again, we have our PICO, our PICOT, and then turning that clinical question that you've created with your PICO into a search strategy takes the following steps. So you have your specific question, choosing the database or what information resource you're going to use for your topic, developing a search strategy to answer your question. If relevant, looking at those different levels of evidence. Are you looking for an RCT? Are you looking for a systematic review or a meta-analysis, or is any clinical article on this topic going to be relevant? And then finally, finding the full text of the article through your library, if that is meaningful at this time. All right, so we're going to go through some, go ahead. Is there a question? Okay, we're going to go through some case studies. And I think I have 4 or 5 in these, which would take us right till about 1 o'clock. And we're going to create our PICO. We're going to create a search strategy, run it, look at the results, and then keep doing that with various searches so that we can all create search strategies together, and also filtering them and narrowing results so that you get a manageable amount of information. All right, so this first one. What effect does use of cinnamon have on a patient with type 2 diabetes? All right, so let's take a minute and let's look at our PICO for this. So again, we have our patient population would be a patient with type 2 diabetes. Our intervention for this patient would be
Cinnamon.
Yep, use of cinnamon. What would the comparison be?
Patients without receiving cinnamon.
Yep, not using cinnamon, or if this clinical question was specifically looking at cinnamon versus another therapeutic agent, you would have that in there. But again, we're just looking at cinnamon. And then our outcome for this would be probably better glycemic control, reduced blood sugar. Now take a minute and figure out which of these parts of the PICO are going to be important for our search strategy. So of course, we're going to have patients with type 2 diabetes. If y'all are able to mute if you're not asking a question, I'd appreciate it. Thanks. Use of cinnamon. And then this gets a little confusing if we're looking at better glycemic control or reduced blood sugar. And at this point, we might not want to add that to our search strategy until we see how many results we have. So here would be a basic PubMed search strategy. So we have our diabetes term. We're going to find those numbers of items, and we're going to go in and do some live searching in PubMed, but we're just going through the basics right now. We have cinnamon. We're going to put those two together with the word and. We're going to filter to English, and we're going to filter to 10 years, which gives us 185 articles. And at the bottom of the screen, I have the following note that using keywords will help you get the most current articles. But remember that your search strategy is only as good as the information you put into that search strategy. So if you think about the word diabetes, what if an article mentioned a diabetic patient or diabetics? If you're searching just for the word diabetes, you might be missing some information that's out there because your search strategy was not as inclusive as it could be. So to that end, this is how I teach PubMed searching. And I use the images of buckets. So buckets have handles which turn into parentheses for you to have your terms for that bucket in the search strategy. And then you and it with the second bucket of your search term, a synonym, and then a mesh term, which is a medical subject heading, which we're going to talk about in a minute. So for diabetes, your bucket might include diabetes, diabetic, diabetics, DM, DM2, again, thinking of as many synonyms as you can. And then we would look for a mesh term, a medical subject heading, if it's available, to increase the number of results we have for this search term. And then we would repeat that for our second term. We would have our text word, we would have the synonym for cinnamon, and then we would have mesh terms if they are available. Okay, any questions to this point? Because usually I have a couple questions when I show this slide. Does that make sense? Go ahead.
A comma or a space, or what has to go in between each word? So like diabetes, comma, DM2, or? Sorry?
You're using or. So it would be diabetes or diabetic or diabetics or your mesh term. And then because they're in parentheses, PubMed will look for any of those terms in the parentheses, any of those or terms, and then it will take all of your synonym terms and any of those terms can be used, but it's the and in the middle that gets you one diabetic term and one cinnamon term to create your search strategy. Does that make sense?
Kind of. Can you say again? So you would say diabetes or type 1 or type 2 and then and cinnamon?
Well, you just want to think of as many synonyms as you can to create your search strategy. So it could be anything. It could be diabetes or diabetic or diabetics or DM. It's whatever you want it to be to kind of create a search strategy that's as comprehensive as you can get it to be, so that you're describing the term as best as you can, because again, your search is only as good as the terms you put into that search strategy. All right. So, and again, here's some additional information. So if we list our synonyms with or in between, so here would be another example. So we could do myocardial infarction or heart attack or MI. And again, it's in parentheses, and the terms are connected with or because you're looking for any of those terms. So or means it'd be any one of those terms that would be found in the search strategy. And then you're using and to combine your words from the different concepts. So the and would be to connect your terms in the two buckets. And then another thing that we can talk about is you can use variant word endings. So like if you're looking for the prevention of a certain disease, if you did prevent with the asterisk, which is a truncation, which is a shift 8, you're getting prevent or preventing or prevention. Just like anaphil with the truncation, we'll search for anaphylactic or anaphylaxis. So it's kind of a quick way to get all of those different endings together. And then finally, to put your search strategy together, you would have diet therapy. This is another completely different search, but kind of showing you the visual. So you're having a diet therapy, and you could use then either, so this would be your bucket of bulimia or anorexia. And then again, you're looking for anything that combines the bulimia and the anorexia and your diet therapy term. So anything that's shaded would be what your search picks up.
So I'm assuming with the variant words, you just have to be careful that you're not throwing out too big of a...
Right. So the example I always use, if you do walk truncation, so if you're looking for a patient who's walking, that would give you walk, walked, walking, but it would also get you walker, the noun of walker. So you just need to be careful. And if you look like you're starting to get some what we would call false hits, you know, a lot of additional garbage that's not really part of your search strategy, then to go back and look at that with the truncation to make sure that it didn't truncate it so much that it is getting some terms and some words that really weren't part of your search strategy. It's a good question.
Will this also distinguish between authors and the article? So in other words, Walker, would it pick up Walker, someone with the last name of Walker who was an actual author?
Yes, and I will show you how to get rid of those in a little bit by using tag fields. Like if you use it for the title and abstract for the word Walker, then it would give you only articles that had Walker in the title and abstract of the article versus as an author. Good question. All right. So some additional searching tips as we're going through this. So you want to select the words from your PICO question statement that will help with the development of the PubMed search. Again, you want to start with your key concepts. Once you've done the search, you can use gender and age limits and other parts that will be added to the preliminary search. We want to look for those alternative word endings like we just talked about. And then again, include synonyms. So there'd be therapy or therapeutic or treatment. Because if you just search for therapy and the article talks about treatment of a disease, you're going to miss that article because your search strategy wasn't complete. So here's, if you're looking for the removal of plaque using a comparison of electric versus manual toothbrushes. So we have our electric term, manual, we have a couple different synonyms for toothbrushing, and then we have plaque. So this will just be a simple example, but as you can see, we have the different synonyms for toothbrush in our search, or for this, you could just do toothbrush truncation that would then get you all of those various endings to the word toothbrush. Finally, as we're going through putting our searches together, we're going to brainstorm synonyms, acronyms, abbreviations to create that complete search strategy. I also like to do a preliminary search and read through some of the titles and abstracts to see if I'm missing some synonyms or terms that I hadn't thought of. We're going to look at the medical subject headings for relevant articles. We're going to do that in just a minute. And then there are other ways you can narrow down your search. You can narrow it by publication limit. Let's say you only want the current 5 years of information, the language. Previously, we talked about publication type. Are you looking for evidence-based practice where you would be looking for those randomized controlled trials, systematic reviews, guidelines, meta-analyses? A quick and dirty way to get search results would be to put your words in the title of the article. And in PubMed, the way you do that is with a bracket, TI bracket. So obviously, if a word is in the title of an article, it's going to be an important topic in that article. So I sometimes will start a quick search with just the words in the title and see if I'm finding 5-10 articles that look relevant. And again, that would be a really quick and dirty search technique to only get a few articles, not a comprehensive search strategy. If you want a little broader casting, then we could do cinnamon in the title and abstract. Or if we're going back to the Walker example, if you put your term that could possibly be an author's last name in the title and abstract, it's going to get rid of Walker as the author. PubMed gives you age limit filters, and we'll show you where those are located. And then finally, a search phrase, meaning multiple words that you want to stay together as a phrase. Putting those words in quotes will keep the words together as you're searching in the database. All right, questions at this point?
Could you say the difference between the TI and the brackets and the TIAB? Because did you say that if you get the title, if you just want the title in the abstract, that will give you a broader search or more articles? Okay.
So TI is going to be limited to just those articles where cinnamon would be in the title. And that might be 15 articles. But then if you do it cinnamon in the title and abstract, you're broadening your results because you're looking for all of those words in that multi-paragraph abstract. That's usually, you know, the introduction, a little bit about the methods, the conclusion. So if title is not getting you enough information, then if you expand the title and abstract, then that will give you a little bit more information. Good question.
So could you do that search together? Could you do cinnamon with the brackets and TI and or could you, would you just say or and cinnamon with the title and the ab together?
So if you do TI, if you do TIAB, it's going to get you title and abstract.
Right.
So you would either use one or the other. You don't need to use
it's going to give you, it's going to give you titles and abstracts.
Right. So cinnamon TIAB will give you the title and the abstract, whereas cinnamon TI is just going to give you the title. But you wouldn't need to do TIAB or TI, because then that's duplicating the efforts. Is that, did I confuse you more or did that help?
No, you didn't.
Okay.
You answered my question.
Awesome. Okay.
Thank you.
So I've talked a little bit about medical subject headings. And this is a very specific concept that's related to PubMed and some other databases, but it is a controlled vocabulary list that the National Library of Medicine, who creates the PubMed database, uses to categorize topics. I like to say, if some of you won't remember, but back pre-1990, before PubMed was an online database, it used to be in paper. And in paper, it came with these big green books with updates, I think every month. And the books came as authors with a listing of all the new articles by author, a listing of all the new articles that were added to the PubMed, the Medline database, by title. And then the third book was by topic, by subject area. And it was a specific list of subjects that were created by the people who created the database. And then they took all those articles that were in the author and in the title list and gave them 1, 2, or 3 subjects. And it's these subjects from that subject heading book that have turned into MESH, which is a method of, again, increasing your results for your search strategy, because hopefully all those synonyms that you're thinking of are pulled into this one subject heading. So MESH takes the guesswork out of choosing terms for searching a database, and it also identifies appropriate or preferred terms to use when looking for information on a specific topic. So you might be searching for heart attack, but when you go to MESH database, it's telling you, well, it's actually myocardial infarction, and to search under that subject heading, you need to use the term that we're showing you is the term that's listed as a subject heading. Now, with that being said, MESH is not available for the most recent 1 or 2 months of articles, and it will not be present for articles that are found in PubMed, but they're coming from other databases such as PubMed Central. So with this in mind, it's not a good idea to just search MESH terms to put a search strategy together. MESH terms will enhance your search strategy of your text word searching that you're looking for in the title and abstract. So again, you don't want to just search MESH, but it's a way to help you find some important articles that should have been retrieved by your search strategy. So if we go back to that cinnamon search and diabetes. So before, we did a really quick and dirty search that was just cinnamon and diabetes. Now, with everything that we've learned in the past 10 minutes, I'm going to show you what an updated, more comprehensive search strategy is going to look like. And it is this. So again, following our bucket formula, we have our synonyms, our term and our synonyms, or I looked up in the MESH database that diabetes mellitus was the subject heading to use as a MESH term. And again, if you put 1 and 2 together, which are your text words and your MESH terms, you get the final number of results. And again, I'm going to go in and show you what MESH looks like right when we're done with this screen. And I'm doing the same thing for cinnamon. So I have the text word of cinnamon. I really couldn't think of anything else. I went into the MESH database and actually found out the MESH term, what they're using to categorize articles that talk about cinnamon, is actually Cinnamomum zeylanicum, which was certainly not something that I would have thought of. And then if we put those together, we have an updated list. And then if we put 3 together, which is our diabetes terms, and 6 together, which are our cinnamon terms, and again filtered to English in 10 years, we have 205 articles instead of the 185 we had previously. Questions at this point? So, and that's what I'm saying about this being an advanced search strategy, because we're thinking of all those different synonyms and we're looking at the MESH term. So I'm going to come down here and I'm going to share my screen so that you can see what this looks like in the MESH database. All right, so everyone should be able to see now my PubMed screen. And if this looks a little bit different, PubMed switched over a couple months ago to a new interface. And this is what it looks like. And it's a little bit different than the old one. As a librarian, I can't say I'm extremely thrilled with it because we lost some functionality that we had in the old PubMed. But it is what it is, and I'm embracing it. And just like anything else we learn that's new, you know, there are some nuances to it. So I took that search strategy from the PowerPoint slide and I put it into PubMed. Now, first thing I want to show you is this mesh database that we've been talking about, because I want to make sure you can visualize where this is located. So in new PubMed, I'm going to come up here and go to the pubmed.gov icon. And I'm going to come down to the bottom and say mesh database. In the old PubMed, you could use the drop-down menu at the search box to choose mesh database. And PubMed swears that they're going to put this back on the database or on the searching screen. So this is mesh. Mesh is the NLM controlled vocabulary thesaurus used for indexing articles for PubMed. So I'm going to come in here. So again, I have my text words, I have my synonyms, and now I'm looking for this mesh term that best describes what I'm searching for. So I'm going to search for diabetes. And I'm going to come down here. I'm going to choose number 1, which is diabetes mellitus. And here are a couple different things. So you can technically add a subheading directly onto your subject heading if that is something that would be of interest to you. If you have a disease and you're looking for surgical therapy for that disease, you could click on surgery and do your search that way. This gives you what are considered additional synonyms that might be added back to your query in the development of your search strategies. And then down here, as you can see, diabetes mellitus, well, here's a type 2. And I could think about using that to narrow the search down completely to type 2, or I can just leave it as diabetes. Now I'm going to come up here, I'm going to add it to the search builder. And as you can see, it added my search term and it added mesh in brackets. Because remember the brackets again from bracket TI bracket. That's telling you what field you're looking for. And I'm looking for it in mesh, and I'm going to search PubMed. All right, so here I have diabetes mellitus, of which there are 425,000 articles used as a subject heading. So that's someone coming in and saying that for these 425,000 articles, diabetes is one of the topics that's introduced and discussed in that article. So then at this point, I can OR that with my synonyms. So we had talked about diabet with the truncation, which will give us diabetic, diabetics, diabetes, any ending. We had talked about DM, and as someone had pointed out earlier with Walker, I'm actually going to tell it to look for DM in the title and abstract so it doesn't pull in someone's initials as an author. Or, let's see, what else do we want to add? Can anybody else think of, I'm also going to do type 2. Again, I'm putting those in quotations because I'm looking for it as a phrase. And I'm also going to do type 2 with the Roman numerals of 2 because I know I've seen diabetic DM2 written that way. And you could do diabetes mellitus type 2, diabetes mellitus type 2 with the Roman numerals, but you're still going to get the same results as you would just doing type 2. Does that make sense? So now our 425,000 articles that we got just using the subject heading are now at 1 million because we've added the text words and the synonyms to our search strategy. So if you click on advanced in PubMed, this is where you see all of your previous search strategies. So if you're putting search strategies together by concept, you can add them here. So I want to go back to the search strategy that came in earlier. Let me see. Hold on.
Can I ask you a question real quick?
Absolutely.
So that's what you want though, right? You're getting that initial category of diabetes. You're trying to get 1 million, 2 million. You're trying to get as many as you can before you start narrowing it down to with cinnamon or whatever.
Correct, exactly. So now the search strategy that I have has the diabetes and it has the cinnamon. So I'm going to come back here to advanced, and I'm going to see I have all of my diabetes terms in parentheses, and then I have all of my cinnamon terms also in parentheses to get me the 290 articles. Does anybody need to see the mesh for the Cinnamomum zeylanicum? Would that be helpful?
I had a question too. I'm following along in PubMed, and do the ORs have to be capitalized? Because when I did that search, it went from 420,000 to 16,000. I'm just trying to figure out why.
So yes, your connector words, your Boolean operators should be capitalized.
Okay,
now,
I'll try
might
that.
not have caused the reason. I capitalize them because I know that that's the proper method of searching, but using that shouldn't have caused that many issues. So this one, I don't have the type 2 with the Roman numerals in it because I was just using other examples, and that might have given you different results. But when you add the cinnamon and the Cinnamomum zeylanicum as the subject heading, it should be way under 1,000 for your results. Now, still 290 is a lot. So let's go through different methods of narrowing those results. So the first thing that we can do is come down here and do our publication date of 10 years. So now we're down to 206 articles. Another thing we can do is look at our article types. And again, when we're talking about that evidence-based medicine, we can do meta-analyses, we can do randomized control trials, we can do systematic reviews. Let me add that one. And then if you come down here to the bottom, there are additional search filters. And these are really good to use for a variety of reasons. Okay, so we have our article types, we have our species, which if you're looking at human or animal studies, language, if you want to limit just to English or to English and another language. Then the other one that's really important is age. And this is a great way to filter if, like, let's say you're looking for an article only in the pediatric population. You could do all child birth to 18. If you're only looking for that newborn infant, you could do the newborn infant, birth to 1 month. If you're only looking for aged, 65 and over. If you're looking for all adults, 19 and over, or aged 80 and over. So these are just additional ways that you can narrow your search strategy down even more. So now that we've done the randomized control trials, systematic reviews, or meta-analyses, we're down to 28 articles. So these are top-level evidence-based articles that we can use. Like here's the first one, cinnamon use in type 2 diabetes, an updated systematic review and meta-analysis. So that's going to pull together results from various studies on this topic to give you one message about the results. Here's a study protocol for a randomized control trial. Here's another meta-analysis. Here's a Cochrane article, which of course is top-level evidence that we're looking for. Now this is from 2012, so that's getting a little bit older than probably we might want, but that might be an article to look at also. And then for any of these articles, if you click on the title, Then if it's available, full text, free of charge, it will be here. If you're coming in from another institution, the full text articles that are available from that institution should also show up here in the full text links that you could then click on and get to the full text for those results. So that would be kind of the process of looking at those articles and the results to see what is of interest. Couple of the things, the new PubMed unfortunately sorts by best match, which is not always, to me, the most relevant. So if you come down here under display options, and I like to do most recent, so then this is going to get the most recent article first. For this one, which is a systematic review and meta-analysis, is from March 2020. So that Cochrane one from 2012 would be much further down the list, almost at the end, since we had filtered to a 10-year publication limit, date limit. So a couple other things now you can do with these results. You can choose a couple of them. Let's say you want to look at those 3 articles. Now you have the following options. You can email yourself or yourself and someone else or someone else the results, and it would give them the title and abstract for those articles in an email. Another thing you can do if you're doing multiple searches and you want to put everything into one area where you can look at it later, there is a format called Clipboard, and that's under Send To and then Clipboard. So let's say you want to do this search and then you've got a couple other searches and you want to just put everything into one pot. You can then keep adding more articles into your Clipboard, and then when you're done with your searching, you can take what's in your Clipboard and then email it to yourself. You can save it as a file and import it into EndNote or any other bibliographic management system that you're using if you're doing research, or you can put it into Covidence if you're doing screening for a systematic review, which was another thing we talked about earlier. All right, questions at this point. So we've got 10 minutes left. I want to go through one more example with you. But any questions to this point in terms of creating a search strategy, using that formula, using the filters that are available in PubMed? Let me show you one more thing, which is that title search that I had talked about earlier. So I'm going to do diabet, which would be diabetes, diabetic, and cinnamon. Both those words I'm putting in the title. So I'm not assuming that we're going to get too many results from this search, and let's find out. Okay, so I'm going to clear all of those filters that I had put in, and I've got 80 results. And as you can see, cinnamon and diabetes are highlighted in each of those titles. So again, that would be a really quick way to get a specific search strategy. I'm going to limit it to 10 years. And now I'm down to 54, but these articles should be relevant, maybe not with the publication type because we didn't use that publication type filter, but in terms of like, here's that systematic review that we had seen earlier, which has cinnamon and diabetes in it. Here is a randomized control trial, cinnamon type 2 diabetes, and this is from December 2019. We've got 2020. Nutrition Journal, etc. Any questions? Is this helping in terms of putting search strategies together as a formula and then filtering using dates and publication type limits? Is that making sense as you're thinking about putting together search strategies in the future?
So the question that I have is, when you go back to the original screen and you start to put in some of the searches that you selected, I'm actually not getting any articles. So then I clicked on the advanced. So I guess I have to just go back and listen to it, but I'm not getting what you're getting.
Are you putting in the search strategies exactly as I've done them?
I believe so, yeah.
Okay.
So goes and mine goes to like, because you know how you had that initial page, mine goes to just a different page, and it keeps saying, so it has the query on there, but it's just
Okay.
different. So I just have to play with it, I guess.
Okay, and you went to pubmed.gov to start searching?
Yeah.
Okay.
Oh no, I didn't do that. Okay, that's what I didn't do.
Okay.
The one where you originally said, I got you.
Okay,
Yeah.
that might also change. So here's the original PubMed screen, here's the mesh database, and then you would type in your search strategies here and then click search. And another item to note for those of you who are at institutions with libraries that have full text articles, you need to start your PubMed search from your library's homepage so that PubMed knows that you're coming in from an institution. So if I just go out to pubmed.gov and type in a search strategy, PubMed doesn't know that I'm at UNC and I want to see all the UNC full text articles. But if I go to the Health Sciences Library homepage at UNC, start my PubMed search there, then I will get links to all of the full text articles that are available to me from my library. So that's another important note that you need to know where you're coming from in terms of the location for your PubMed search so that you are getting those full text options if they're available to you from a library, from an academic institution. All right, we are gonna try. Okay, so here is another search strategy, and we're probably going to get through most of this, and then that will be the end of the session for today. For those of you who have joined us later, the slides will be available to you. I'm sending them to Anne. I'm also sending her a recording of this Zoom instructional session, and all of this will be available to you if you need to refer to it later on or want to keep going with these searches, because I have another 3 or 4 search strategies included in the PowerPoint slides that I know we're not going to get to today, but they are available if you want to try those searches. So we have a 30-year-old male diagnosed with depression. He would prefer to try alternative medicines rather than SSRIs. You believe that his disorder would be improved with an SSRI, but the patient would like to know if he could take St. John's wort and if it would be just the same and just as effective in reducing his symptoms. And here's a pretty picture of what St. John's wort looks like in nature. All right, so again, let's do that PICO so that we can come up with our buckets for our search strategy. So a patient with depression, an adult, probably maybe not as important at this point. So our intervention is the use of St. John's wort, and we are comparing that with the use of SSRIs, which again, we're gonna want articles that compare and look at both, not just articles with St. John's wort at this point. And then we're looking at the outcome of a reduction of depressive symptoms, reduction of depression moving forward. So again, if I'm going to come up with the buckets that I'm going to use for this search strategy, I would do depression, I would do St. John's wort, and I would do the SSRI, because again, we need those articles that are comparing the 2 therapeutic options. And at this point, I would probably leave off that outcome because that might narrow down my results so much that it's not going to get me what I'm looking for. All right, so again, we're doing that comprehensive search strategy where we're looking for our text words and our mesh terms together. So just to go through the search strategy quickly, we have our text words, depression, or you could just do depress with the truncation to get depressive, depression, depressed, anything. I went to the mesh database and I found 2 subject headings. There's depressive disorder and then there's also depression. And I've put those 2 together. If you are following along and you're doing your own searches, this items found number is going to be a bit different because these were run probably about a couple months ago. So of course, PubMed's adding new articles every day. So this is kind of an estimation of what the results would be. And I'm gonna do the second bucket, which is my SSRIs. So I'm doing SSRIs. In quotations, I'm doing the selective serotonin reuptake inhibitors. I'm writing it out, and I'm doing the same thing with inhibitors with the S. So one thing to keep a note, PubMed is one database that unfortunately is not able to do truncation and quotation marks together. So if I did selective serotonin reuptake inhibitors and put the truncation inside of the quotation marks, we would not get the full number of results that we should get. So you have two choices. You can either write them out as I did, or you can use the truncation but without the quotes. And then I found the mesh term also for SSRIs, and you might want to add in here specific SSRIs, the drug name, the trade name, the generic name, into your search strategy. And again, I added those together, my text words and my mesh terms. And I'm going to do this.
So do you type it into this screen so that we can see what you have?
Oh, I'm sorry. It's not. Yes. Thank you for letting me know. Okay, can you see this now? PubMed search strategy, the blue and white screen?
Yes, thank you.
Okay, thank you for letting me know. I always forget to do that when I leave PubMed and come back. So again, we have our depression terms, our SSRI terms, and then St. John's wort's a little funny because sometimes it has the apostrophe, sometimes it doesn't, sometimes it has a period, sometimes it doesn't. So playing around with the most comprehensive method of getting all the results for that. And then the mesh term for St. John's wort, I went to the mesh database and found that it was hypericum, which again wasn't something that I thought about. And now I'd probably want to add hypericum to my text word list because I found that again as the subject heading. And I'm adding all of these together, and then I'm adding the different search strategies. So 3 and 6 and 9 would get me the depression, the SSRIs, and the St. John's wort. I'm just going to give you a second to take a look at this and follow along because I know there's a lot of information in here. And then that gave me, when I added the 3 topics together, 145 articles. All right, so here's a link to the results. Okay, so here's our 145, and again, the search strategy is up here exactly as we just wrote it out with our text words and with our subject headings. And then again, I could filter down the side to 10 years, St. John's wort, drugs for depression from medical letters. Now, some of these, you're going to have to look in the abstract of the article because some of these we're not seeing. Like this one actually talks about St. John's wort in comparison to SSRIs in adults. And this is a meta-analysis on the efficacy and safety of, and then looking at the comparison of the 2 drugs, which is what we're looking for in this search. So this one would definitely be of interest to us. And again, then you can show more and go through the rest of that list. Any questions? All right, so it is 1 o'clock. I am going to share, I'm going to go back to my PowerPoint slides, and I'm going to share a couple more things just so you know what's included in the rest of this. Okay, so here's another one, relationship between H1N1 and myocardial infarction, if you want to go through this one on your own. And again, I've written out all the search strategy. You can take a look at it. And then here's another one for non-surgical management of patients with carpal tunnel syndrome. This one's a little bit more advanced because the non-surgical management can bring you many different areas. So I've talked about physical therapy, non-surgical, conservative, complementary. So again, that might be one to look at. And then finally, at the end of the slides, the information about My NCBI, which is a way to save your search strategies, to create save searches where you can be emailed every week or every month on a specific topic of your choice that you would like to know what articles are currently being published on that topic. You can use that for institutions, for authors, any way that you want to. Some people use those save searches for title of content, table of contents from articles, so that every month they would be emailed the table of contents from a certain journal, and they could peruse the titles using that method. And then here are additional slides on other databases that are available, search strategies for using those other databases. And then this last thing, which kind of is a little more advanced, but I wanted to let you know that a search conversion tool, if you want to do a search in PubMed and then you want to run that search in other databases, this is a tool. You put in your PubMed search strategy and then it will find the search strategy for the other databases, because each database is a little different in terms of how it's set up for field tags, like that TI and brackets is different in other databases. The other databases don't have mesh, but they might have their own listing of subject headings, or they might be completely text word based, like Google Scholar, like Web of Science, like Scopus. You would then just be relying on those text word searches and not have that mesh database as kind of a way to fall back on finding additional articles on your topic. All right, so I know that was a lot of information today, but I was tasked with kind of doing a more advanced searching strategies for you as you move forward. So again, I'm available to help at any time. My email is on the first slide. If you would like to contact me to get additional information, or if you have some questions and you don't have a home librarian that you can ask, I'm certainly willing to keep working with you as you go through building search strategies in the future. All right, any other questions at this time?
I think I just need to go practice at this point.
Yeah, and that's why I put in some additional searches so that you can practice and get some additional practice.
Awesome. Well, thank you very much. I appreciate it.
You're welcome. All right, well, I'm going to go ahead and end here. And again, if you have any other questions, please feel free to let me know. And good luck with everybody. And I'll talk to y'all soon. Take care.
Thank you.
You're welcome.